Hello, my name is Alexis, and I want to begin with a simple question. What would you do if you had to choose between paying your bills or buying dinner? This is a harsh reality for millions across the country living in constant uncertainty, living food insecure. Food insecurity can be defined as an economic and social condition of uncertain access to adequate foods. This can be due to constraints based on income or the affordability of healthy foods. Similarly, food deserts are areas where the population has limited access to healthy foods. This could be due to the lack of full service supermarkets and grocery stores or lack of transportation means getting there. This map of the US shows how prevalent food insecurity is amongst residents in each state. When we look at this in conjunction with a breakdown of households experiencing food insecurity, we see that it is more prevalent within low-income minority groups, those living in rural areas and in the South. Families and individuals facing long-term insecurity are at risk of a variety of negative health effects. Hunger can lead to prolonged exposure of stress. Some people don't know how they're going to get food on the table, other financial responsibilities take precedent, or they prioritize feeding their children over themselves. When time is a constraint, the convenient option ends up being fast food, which lacks nutrition. These decisions put people at higher risk of developing chronic diseases such as obesity, diabetes, heart disease, malnutrition, and even cancer. Negative health outcomes and medical costs can be a financial strain to low-income populations. Over 65% of households served by Feeding America reported having to choose between food and medical care, and close to 80% of households reported having to choose inexpensive, unhealthy food just to feed their families. And such a vicious cycle of hunger, disease, and poverty continues. So, how can such a complex issue be resolved? Well, government programs such as SNAP need to continue to support those that need it the most, as they have proven to help stabilize rural economies and support local grocers. Local initiatives can be the most impactful, though. Implementing farmers markets, community gardens, and mobile food banks can help with the affordability and accessibility of healthy foods. Quality education in schools about diet and hiring in-store nutritionists would help educate communities on healthier eating habits. Healthier eating habits can lead to more productivity, helping underserved areas thrive and escape food insecurity.